Hello and welcome. Today we're diving into a rare but fascinating condition affecting the eye, coloboma of the lens. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, let's embark on this journey to understand coloboma of the lens. The exact cause of coloboma of the lens is complex and often multifactorial. It's primarily considered a congenital anomaly, meaning it's present at birth. This usually stems from disruptions during the early stages of eye development in the womb. Genetic factors are frequently implicated, and coloboma of the lens can be associated with specific genetic syndromes or chromosomal abnormalities. In some cases, environmental factors or exposure to certain substances during pregnancy may play a role, but these instances are less common. It's also important to note that sometimes the exact cause remains unknown. Now, let's understand how coloboma of the lens develops. During normal eye development, the lens forms as a sphere-shaped structure. In coloboma of the lens, there's a failure of the lens's edge to completely close or fuse in a specific area, usually the inferior or infranasal aspect. This results in a notch or indentation, creating a defect in the lens margin. The defect disrupts the normal curvature of the lens, which affects how light focuses onto the retina. This can lead to various visual disturbances depending on the size and location of the coloboma. Coloboma of the lens is considered a rare condition. Precise epidemiological data is limited, but it is generally reported as an infrequent finding in ophthalmological examinations. It can occur sporadically or as part of a wider spectrum of developmental abnormalities. Due to its association with genetic syndromes, prevalence may vary across different populations and geographic regions. Larger studies and registries are needed to get a more accurate picture of its true incidence. The signs and symptoms of coloboma of the lens can vary widely depending on the size and location of the defect. Some individuals may be asymptomatic, especially if the coloboma is small and doesn't significantly affect vision. However, common symptoms include blurred vision, reduced visual acuity, glare, or sensitivity to light. Patients may also experience double vision or distortion of images. In some cases, individuals with lens coloboma might also have other associated ocular or systemic abnormalities, so a comprehensive evaluation is crucial. Diagnosing coloboma of the lens typically involves a thorough eye examination by an ophthalmologist. This includes assessing visual acuity, checking for refractive errors, and performing a slit lamp examination to visualize the lens and other eye structures. The slit lamp allows the doctor to see the notch or indentation in the lens characteristic of coloboma. Additional tests, such as ultrasound biomicroscopy or optical coherence tomography, may be used to further evaluate the lens structure and any associated abnormalities. Genetic testing might be considered if there is suspicion of an underlying genetic syndrome. While there isn't a formal classification system with distinct types of coloboma of the lens, they are generally described based on their location and size. They can be complete or incomplete, referring to whether the defect extends across the entire lens margin or only a portion. The most common location is infranasal, meaning it's located on the lower, inner part of the lens. Describing the coloboma in this way helps guide treatment and predict visual outcomes. Treatment for coloboma of the lens is primarily focused on managing any associated vision problems. If refractive errors are present, eyeglasses or contact lenses can be prescribed to improve visual acuity. In some cases, surgery may be considered, particularly if the coloboma is large and significantly impacting vision. Surgical options might include lens extraction with intraocular lens implantation to replace the defective lens. However, surgery is not always necessary or appropriate, and the decision depends on the individual case and the severity of symptoms. Regular eye exams are crucial to monitor the condition and adjust treatment as needed. As a congenital condition, coloboma of the lens is not typically preventable. However, genetic counseling may be beneficial for families with a history of the condition to understand the risk of recurrence. Prenatal care and avoiding exposure to potentially harmful substances during pregnancy are always recommended for overall healthy fetal development. Early diagnosis and management can help optimize visual outcomes and quality of life for affected individuals. The prognosis for individuals with coloboma of the lens varies depending on the size and location of the defect, as well as the presence of any associated ocular or systemic abnormalities. With appropriate management, including corrective lenses and sometimes surgery, many individuals can achieve good visual function. Research is ongoing to better understand the genetic basis of coloboma of the lens and to develop more effective treatments. Advances in surgical techniques and intraocular lens technology continue to improve outcomes for those who require surgical intervention. Regular follow-up with an ophthalmologist is essential to monitor the condition and address any new developments or complications. Thank you for joining us in learning about coloboma of the lens.